The following program is presented by the Injury Prevention Institute of the Emergency Nurses Association.
SBIRT stands for screening how often you drink on a weekly basis, brief intervention when you do drink, how many days, and referral to treatment. How many drinks you have at that time, how many days a week you drink.
I'd like to think that even someone asking more of those questions would have made me look and say, what am I doing?
We do it without knowing. We drink to the excessiveness where we get stupid or we just don't care, I believe.
And that's not even to say that what that particular behavior is wrong or right.
They had to bring it to my attention.
A lot of patients don't know how to help themselves or how to even make a beginning, and that's what we give them, hope.
Hope is something to look forward to. It's for patients to say that I understand this is bad right now.
The nurse came across with a good attitude. He seemed like if he cared.
As a healthcare provider, I can help them understand that they're not alone and that this can get better.
You would ask the questions. They're either going to tell you the truth or they're not.
It's the encounter with a message, time and time again, that gives people the opportunity to change.
Not every person is going to make a change, but the one that does, you could have just saved someone's life.
We can help them help themselves.
Regardless of how terrible the decision may be, there's a chance to bring life to it. There's a chance to renew it, and there's a chance to make something good come out of it.
Christine's going to start an IV on.
I was at work, actually, and I got really sick, so I ended up going to the hospital that evening. They took me right away because I had an asthma attack. You want to see that someone has some type of interest in you when you get there. Sometimes you get it, sometimes you don't. The counselor came in, and he was going to do a survey on alcoholism and how much it affects us, and did I know how I harm myself.
If you can get them in a teachable moment, a lot of times right after an injury, you have a short time where you might catch something that they've never realized before is a problem, that you can identify as a problem, and it puts a new light on things.
He wanted to hear what I had to say. So I sat down, he started giving me these questions. One in particular, he asked me in a span of 8 to 10 hours, how long have you been drinking? I told him, well, 10 hours. You know? He goes, well, you drink a little too excessively. I blacked out twice. I still can't believe that.
Most of those patients are shocked, but they're also more apt to listen further, accept the brief advice, accept the educational material.
I felt that I was able to talk to him, so I was glad he was there.
Most people think about alcohol abuse affecting their liver or how it affects their health, but it also, since it puts you at such risk for injury, it's also a health choice.
Go ahead, 911 dispatch.
Was the drinking behaviors that I were involved with something that I considered to be a risk? I really didn't think so. The real problem was I didn't know how much too intoxicated was. Those are the kind of facts that emergency room nurses know, that the average person isn't aware of. So while I didn't think that the things that I were doing were terribly risky, the reality was that they were. And I needed somebody to tell me and explain to those in a real clear way what was going on.
If you provide that information to a patient, so they decide not to make a change today, but you've planted that seed. So maybe the next time somebody talks to them, or maybe the next time they go to pick up a drink, they'll identify that they might need to make a change in their life.
Time management, task orientation, those things make it very difficult to sometimes spend 5 minutes or 10 minutes at a bedside. My first thought was, I don't have time. I can't make this happen on top of all the other things that I'm doing during my day. And then I realized that I'm not working at 100% all day long every day.
When I look back on my own experience of being in the emergency room that evening, remembered so clearly the vulnerability, the openness to hear things that I might not otherwise have been willing to listen to. Right now, I am a seminarian. I never would have imagined that I would have been capable of something like this. Not the profile of somebody who you would think would have too much to drink and then get behind the wheel of a car. Myself and several other friends from the seminary had gone out to a restaurant. When it came time for us to leave, the person who had driven was clearly too drunk to drive and handed me the keys to the car. My judgment became impaired as a result of alcohol and reckless behavior, resulting in a crash that did eventually kill two of the men that were in the car.
There's a ripple effect that occurs with any traumatic injury. And maybe first it affects the individual, but then it affects their family, their friends, their jobs, their coworkers. It affects multiple aspects. If I can help prevent that one injury from occurring, I can help be a part of preventing that ripple effect. There's not any one particular healthcare provider that I think has a higher impact on that.
I remember what it was like to be rushed into the emergency room and be surrounded by people taking blood, doing all kinds of assessment of myself. In came another emergency room nurse. Her name was Athena. And I remember what it was like as she looked into my eyes and said, I know that whatever happens to you as a result of this, you're going to be different and you're going to be a better person for the experience that you've gone through. I don't think that we're normally ready to receive or take to heart seriously messages that people have for us. The emergency room is a very different situation. All of our being is open in that emergency room. And nurses have an access to a private, a sacred time in our lives, at which a big difference can be made, even by a few words.
As a nurse, you have to wear many hats. So you have to provide medical care for those patients, but also interact with them and show compassion. If they want to make a change in their life with their alcohol use, we want to provide them with a realistic plan. And it has to be the patient's choice. It can't be our choice.
The nurse, he didn't come across like judging me in any which way or form. The way that he presented himself, more or less we took it as a joking pastime, you know, but it was a fact. That made me realize what direction I was going, what steps I had to take. He gave me this flyer, and it was stating what alcohol, how it affects you. And I looked at it, and I'm like, all right, you know, you made me think about it. Like, no, I'm not an alcoholic, but I feel that if I continue, I could be.
It's the same as, you know, sending a child out into the community. We wouldn't do that. We wouldn't send a child out into the community without a child safety seat. Or, you know, we provide information to our cardiac patients about smoking cessation, or diabetics about changing their diet.
I have information to give them to show them what's low risk, what's high risk, based on the information that they've given me. And then I give them the information, and I let them decide what it is they need to do, what it is they want to do.
SBIRT is screening, brief intervention, and referral to treatment. Screening is using a tool that identifies at-risk or high-risk drinkers and then provides a brief intervention, identifying that they have at-risk behaviors with alcohol, and then a referral to treatment. If they need to have further treatment or they need a professional to talk to, then you can refer them to a treatment center.
This got started by recognizing that many people who present to healthcare settings have never been screened for alcohol misuse, and it turns out in both hospital and particularly ED and trauma settings like I work in, there are many people who drink alcohol at problematic levels, and most treatment in American society is geared towards people who really are dependent on alcohol, and whereas if we can detect people with alcohol use disorders or even the potential for developing alcohol use disorders, we can actually provide very short forms of therapy that can alter their problematic alcohol use later and decrease their chances of them becoming dependent drinkers.